Today we're going to talk about gerontology. My name is Irizan. I'm a lecturer from Department of Family Medicine. So today the introduction is we're going to talk about the gerontology. Later on we talk about physiological changes in older age. Also health problems have been faced in older age we will discuss on this lecture. Also, psychological problems, very common in older age, we would figure out in this lecture. Also, prevention and management, and also what kind of services are provided in the older age, we would figure out on this lecture. So, what is gerontology and geriatrics? So, from the term gerontology, especially clinical gerontology, that's a science of studying physiological and also psychological change which have been encountered in older age. So what is the aging? That's the progressive generalized impairment of body function. So what kind of in which age it assumed for older age? So from 60s, average of 60s, they have been estimated as older age. So old age is not disease, but it's a normal process. It's a normal biological phenomenon. So before gerontology, we need to figure out about aging theories. For example, genetic theories. For example, somatic mutation of genes. Also, genetically determined lifespan. Also, cross-linkage, important cellular components of DNA. And most common used theories of that is somatic mutation and cross-linkage of components of DNA. Most has been implemented. A lot of research study on that. So also there's other biological and molecular theories in old age. For example, there's a free radical theory. It's the most common used theory. And also wear and tear theory. That's one of the most describing theories in old age. So we need to figure out about what is the branch of geriatrics. There's a gerontology. Those branches are clinical gerontology, social gerontology, and geriatrics gynecology, also experimental gerontology and preventive gerontology. So what is the health problem? What physical problem have been faced in that age? The main thing is physical problem, psychological problem, social problem, and economical issues have been faced in that age. For example, 99% of all the person have been faced with the visual problems, visual complaints. For example, the most common illness of visual complaints is cataract, glaucoma, and retinopathy. There's a number of 85. 85% of all the age, they need to be preventable disease. Also have been complicated with blindness. So we need to prevent all those illnesses. For example, lacrimation, reduced lacrimation, and retinal degeneration of cochlea and hair cells. That's the most common illness in older age. We need to prevent all those illnesses because it would not complicate it as blindness. Locomotor system, it's faced in 40% of old age. The most common illnesses fibrositis, osteoarthritis, rheumatoid arthritis, and myositis. So what's happened in musculoskeletal system? Of course, a reversible loss in its fibers, also deposits of fats, loss of mineralization, and those changes have been caused of osteoporosis and all other illness. For example, in neurological complaints, there is common illnesses, dementia, Parkinson's disease, and Alzheimer's. So, what happened in central nervous system? Degeneration happened, also reduced transmitters, and that's why in older age usually encountered with impaired cognition and behavior, also lowering of activities, and that's why in most of old age there's a illness, for example Alzheimer's and other dementias, and also slow of substance secretion have been faced in that age. So what happened in cardiovascular complaints? The common changes is that atherosclerosis, thrombus formation, myocardial infarction, and hypertension. What happened in the cardiovascular system? Reduced cardiac myocytes, reduced nodal activity and conduction, rigid and narrow blood. That happened. From those changes, the complicated changes have been reduced cardiac output, arrhythmia and heart blocks, and hypertension. And that's what overall happened in cardiovascular system. What happened in respiratory complaints? It's happened 60.1% of all system illness. The most common are chronic bronchitis, asthma, and emphysema. So what happened in the respiratory system? Reduced cough, reduced lung elasticity, and reduced alveolar surface area. So that's why we called all motor function have been failed, altered in older age. And another changes happen in older age is that skin condition. Skin condition form a major part of old age. So what kind of common changes happen in skin is senile wrinkles, scaly lesions, scaly dermatosis, and blistering disease. So what happened in skin in older age? So loss of elasticity of skin. That's why it gives wrinkling in the skin. Also loss of hair. It could be encountered with alopecia and baldness. Also breathlessness of fingernails happened in older age. What happened in GI tract infection? So everybody could know about the popsicles is so common in older age. Constipation is so common. Also ulcerative colitis and cancer of GI tract is most common illness in GI tract. So what happened in GI tract? Reduced acidity, reduced regeneration. So that's what reduced from gastric acidity. It causes for non-ulcerative dyspepsia and constipation. So from the reduced regeneration of capacity, that gives rise of impairment of metabolism and detoxification. So how about the endocrine system? It's very common illness in old age. So one of the most common is impaired glucose tolerance. That's we call hyperglycemia. Impaired thyroid function. That's cause of the hypo and hyperthyroidism. Disturbed vitamin D metabolism. That's caused osteomalacia. Reduced sex hormones. That's a cause of impotence in males and in reproductive system. How about hearing loss? Hearing loss is most of the common illness in old age. So what happened in there? Nerve deafness. For example, there's a deafness very common in older age. Also, conducting hearing losses mostly happen in older age too. Whereas genitourinary complaints have been faced in that age. The most common is enlargement of prostate. So what happened in urinary tract? A reduced number of nephrons, reduced renal blood flow, also reduced bladder capacity. And that's why in older age there have been impaired excretion and incretion. Also urinary incontinence usually faced in that age. So geriatric gynecology, what has happened there? There's usually atrophy of vagina. It tends to give atrophic vaginitis. Weakening of pelvic muscle. It gives rise prolapse of uterus. Okay, let's talk about psychiatric complaints. There's a lot of psychiatric complaints in that age. So most common of them is Alzheimer's, depression, anxiety, delirium, and schizophrenia. So what happened in other system? For example, atrophic mucous membrane, loss of teeth, decreased number of taste buds, and decreased secretion of salivation. So what has happened there? Reduced food intake and then change of taste and smell. So let's talk about physiological problem. So before talking about that, please see that picture with white and black and not fully downloaded. So psychology in older persons like this picture. So what is the psychology? What's the main problems there? Anxiety is the most common problem in older age. Physical discomfort is most common of that. And adaptation to a new lifestyle is one of the most triggering illness in older age. So what kind of signs have been faced in there? Sleep problem, insomnia, low of interest, guilty in something, lack of energy, poor concentration, appetite is lowering, psychomotor changes happen in physiological changes. For example, major depression symptoms. So, for example, in geriatric depression, main symptom is that mood and cognitive changes. The most covered signs is that appearance, behavior, and psychomotor retardation usually happens. So incidence in elderly, major depression is usually caused 3% of community dwelling, 14% 2 years after suicide, 15% medically ill, 25% long-term case settings. So let's talk about social problems. What kind of social problems have been faced? Abuse, dependency, insecurity, and rehabilitation. So abuse, that's the financial and other material maltreatment. Classification of older abuse, might be psychological, financial, or physical, and sexual. And most of them is physical abuse, physiological, emotional abuse. So what is the financial? It's a lack of financial resource. So what's the sexual? So there's a non-sexual contact of any kind of other person. What is neglecting? It's a refusal or failure to fulfill caregiving obligation. So what is dependency? Usually that's covers with physical, financial, functional dependency. That's a really bad effect into self-esteem of the population. What is this insecurity? Insecurity often caused by abandoning of their children. So in older age, the most important thing is rehabilitation. So economical problems faced in that age because of lack of financial source. So let's talk about prevention and management. That we need to make assessment in older population, for example, physically, functionally, psychologically, and socioeconomically. We need to assess in older age. For example, the assessment need to be cost effective, maintain older activity, and providing quality care up to the maximum satisfaction of the population. Evaluation of newly discovered risk factor is that we need to, in severe functional disability, we need to hospitalize. Mild to moderate dysfunction, we need to find out the cause of the illness. If the cause already found, we need to give drugs and caregiver support and plus rehabilitation. If there's no cause, we need to do patient support, caregiver support, and rehabilitation. So for the older population, the group of discipline, group of professions, for example, we call multidisciplinary geriatric assessment is really crucial for this period. For example, there consists of gerontology physician, gerontologist physician, physiotherapist, occupational therapist, ophthalmologist, audiologist, psychiatrist, and dietitian. So prevention. As you know, there's a third, second, and tertiary prevention. What is the primary prevention? It's also caused before the illness, so we need to focus on nutrition. If there's inadequate nutrition, tend to give the disease. For example, we need to focus on smoking and alcohol consumption. We need to reduce the abnormal behavior. There's a lot of lack of exercise. We need to increase that. inadequate sleep is very common in that age. So from those kind of factors, the disease, for example, obesity, hyperthyroidism, diabetes, and also illness have been faced in that old age. So for the first prevention, we need to talk about immunization. That's covered from influenza, pneumococcal vaccine, and tetanus vaccine. And also we could talk about the calcium and vitamin D supplementation. So from the first prevention, we need to talk about injury prevention. So in order to do that, we need to free of all obstacles on the floor, keep the floor dry, bright lighting, holding bars in bathrooms, low-level switches, easy and safe access to water. What is a secondary prevention? That's usually with the illness, for example, hypertension, diabetes, dental problems, drug adverse effects, and cancers. We need to be assessed, follow up, and examined routinely. So in that, we are preventing from complication of those illnesses. So for the tertiary prevention, that's rehabilitation, and usually talks about rehabilitation. So rehabilitation is a problem-solving process focused on the patient's functional abilities. So rehabilitation team includes physician, psychotherapist, occupational therapist, and speech and other professionals. So let's talk about the intervention in rehabilitation. This is composed of drugs, physiotherapy, occupational therapy, and adaptation, speech and language therapists. So what does support need to give for old age? Social attitude, physician support. So we need to go to the daycare centers. It really gives a good encouragement for the older population. So prevention and management for older abuse, that's need to assess by those 5 assessment tools. For example, assessment of physical and mental capacity of the elderly, assessment of general quality of care, assessment of relation with the abuser, assessment of abusers for their problems, and also counseling the abusers. That is the main assessment of the person. So those lectures have been taken from those sources, and also if any questions, please mail or physically ask about what you couldn't understand about this lecture. Also, so thankful for your concentration, and please